We have two lectures this week. The first lecture you watched was a prior video that I taped talking about HR and human resources. And one of the biggest things in planning a successful pharmacy is having the right people. And so hopefully when you watched that, did the readings, that helped you think about what are the type of people and the importance of having job descriptions. The other responsibility of being a pharmacy manager, owner, is risk management in pharmacy. We're going to talk about the elements of risk that exist in every human activity. And as a pharmacist and a pharmacy owner or pharmacy manager, we must deal with the risk of business. And there is risk in business decline and failure. There's always threats from the economy, changes in reimbursement, natural disasters, and indeed there's a degree of risk that it's inherent in performing most common tasks in any pharmacy, and in the worst case scenario, putting ourselves at risk for either theft, mishandling of laws like DEA laws, Controlled Substance Act, or med errors. But as we know all the time, that healthcare is changing, and it requires the pharmacist to be more cognitive of their surroundings and to examine those risks in their practice. Historically, traditionally in a community pharmacy, the primary risks were fire, theft. But now modern pharmacy practice must consider new risks: the use of technology and electronic data transmission, the protective of private data. We also have the risks of, as we try to evolve into more enhanced pharmacy services, that we have to offer things such as counseling, consultation, and so that might put us at a greater risk for liability. And as I said before, not only do we have to protect our patients' private health information through our technology, but we also have to protect it among our staff, making sure that they're properly educated, and how we handle everyday interactions with our patients. The definition of risk in general is risk is associated obviously with negative outcomes. A risk is anything that threatens the ability of a person or an organization to not accomplish its mission. In order for a risk to be a threat, there must be some different change that a negative event can occur. There also to be a risk, there has to constitute a hazard. So for example, you starting an immunization business, there is the risk of patients having anaphylaxis attacks, shock. So how do we protect ourselves? CPR training, have an emergency protocol with the physician to handle by administering of an EpiPen or diphenhydramine. The other thing is we always have to look at the severity of the consequence that negative risk might be. And when we are trying to get insurance to cover those risks, the insurance company is going to look at the speculative of the risk and is it a pure risk. And so the more liability insurance increases, the greater the risk is where we cannot control what happens. A speculative risk involves chance of gain or benefit as well as loss. A lot of times speculative risks obviously are not insurable. So somebody who takes a gambling, alright, purchasing shares to a mutual fund or common stock as an investment is a speculative risk. It is all depending upon the market. But what about operating a pharmacy? Does it involve speculating risks? It can, from your chance of starting the business. And that's the importance of being able to do strategic planning and business planning. Because only 40% of any newly established business, even beyond community pharmacy, only survives at least 4 years. Pure risk, it is this. It involves risk in which there is only the opportunity of sustaining a loss. There is no opportunity for gain. Pure risks are considered accidental, unanticipated, or unavoidable. Example, illness, death, fire. Insurance is a product designed to assist people in managing their exposure to these accidental risks. And insurance will be higher if the risk is harder to contain or control. The identification and management of peer risk are essential for a business to manage potential threats to its mission. So what's the criteria to be able to be insured for a risk? For a pure risk to be insurable, it must meet certain requirements. The loss must be measurable in dollar figures, easy to measure, and result in substantial loss. There is data the insurance agency already has based on types of injuries related to medication errors, immunizations, and although this is still a gray area, we don't have a lot of data on consulting and MTM services. And one of the reasons why pharmacy professional liability is low at this point is there's not a lot of cases against pharmacists in regards to consultation. For it to be an insurable risk, there must be a way to document the time and place of the loss. And the loss obviously has to be accidental for it to be insured. Another criteria for insurable risk, the probability of the event occurring in population can be accurately calculated. There must be sufficiently large number of homogeneous individuals with similar risks to make losses predictable. And so an insurance company is not going to insure you if they don't have data of that risk. They're also not going to insure you if the law doesn't say that you are allowed to do this. The insured must have an insurable interest. Compensation cannot be awarded to those not actually suffering the loss. And the insurance premium must be available for reasonable cost. So how do we develop a risk management strategy? A risk management process should be developed to analyze and identify strategies to manage risk threats, protect the vital assets through coping with uncertainty. This process involves not only identifying risks, but also assessing their potential threat and making decisions on managing those risks. The risk management process. For this to occur, a pharmacy business should look at what are the goals of risk management process? What are the potential vulnerabilities? Both the Institute of Safe Medicine Practice and APHA actually has data on their websites and resources to help a pharmacy to assess where are their risks. Do employees or patients risk injuries? And obviously, safety should be concerned, because how might the reputation of a pharmacy suffer if a patient was injured owing to a prescription error, or if his or her health condition was inadvertently made public by an employee? That is why analyzing your workflow, your documentation process, your verification process is a must in your business. Sometimes this is a lot of times overlooked in small community pharmacies because we think, oh, we only have 2 pharmacists and 2 techs. But the ability to do barcode scanning, the ability to do some type of verification process of checking the drug against the NDC, the ability to do quality assurance checks and also recording and monitoring med errors and coming up with action plans of how to do this. Because costly claims can be avoided by not providing certain services or products. But obviously, for a pharmacy to want to move into more enhanced services, we have to make sure that we have good ways to prevent risk from our distribution process. The risk management process should also identify and analyze risks. Pharmacy managers should start by analyzing the dimension of their operation. Some examples of risk faced by pharmacies include activities inherent to their business. Examples: filling prescriptions, counseling patients, and providing professional services, immunization. What is the step process that your pharmacy does to prevent med errors? What is the analysis you do to analyze the documentation that's occurring? Other risks that a pharmacy owner has to take into consideration is their delivery drivers visiting neighborhoods, and obviously the safer thing is probably driving in unmarked cars. Your business maintaining the building's sidewalks and parking lot so people aren't at risk for falls and injury, making sure that it's cleared in the wintertime or hazardous weather. There are risks if you get into compounding, making sure you're following standard sterile product regulations both on the federal level and the state. How does your pharmacy computer system verify the accuracy of your patients? How does your pharmacy computer system, do you have a firewall to protect, from anybody invading your system and protecting patients' health information? Obviously, too, these are things that sometimes are often overlooked. So we should always evaluate and prioritize the risks. Some risks are fairly common, yet are not associated with a high degree of loss. Example, shoplifting. However, I'll tell you a story. I have a friend of mine who has a pharmacy, and they had theft insurance, but they at one point discovered they had internal theft. They had an employee that was stealing lottery tickets from them on scratch-offs. And when they assessed what their loss was, they had paid out to the lottery over $1 million. This patient, not the patient, but the employee they could not even go against any action to this employee because their wages and their assets would never recuperate that. So one of the things we always want to look at is are we insured enough for things such as theft, fire, and how often do we revisit how much we're insured? Other risks are much less common and yet are associated with substantial loss. Example, catastrophic damage from fire, flood, or storm, or harm to a patient associated with a dispensing error. In the risk management process, we should select an appropriate risk management strategy and implement the technique. For example, pharmacy managers must determine which risks could and should be avoided. So how do you spot check? One of the ways you could do that is your pharmacist, when they go to file prescriptions at night, do a double verification of that. To protect yourself of risks of inaccuracy in submitting to the prescription drug monitoring program for controls, I encourage people to run a report of how many controls you are submitting that night and to verify those prescriptions to make sure that there's no inaccuracies being sent there. What is your workflow? Do you use any type of technology for barcode scanning, for checking verification? You may also, if you get into pharmacy enhanced services like diabetes education, pharmacogenomics, collaborating with physicians, you may have to have additional insurance policies or add-on riders to be secured as necessary. It's a requirement in Pennsylvania under our collaborative practice law that all parties, and including each pharmacist, carries at least $1 million per occurrence in professional liability. So additional riders are usually supplemental policies provide additional coverage for something not covered in the original policy. So for example, if we add on immunizations or some type of more advanced MTM education services, we should think about how we're going to cover those. I know in Pennsylvania, at least, in talking to different insurance brokers, and I encourage you to do this, that a lot of them, that rate does not increase much when we do add these additional riders because they are within the scope of practice of a pharmacist and the risks are very low in terms of reporting of damages that have been recuperated from patients due to these new services. Thought should go into the level of deductibles to appropriately balance risk sharing and risk transfer issues. Obviously, it's nice to have a low deductible, but if you think your risk is low, having a high deductible will decrease your insurance premium. We also need to monitor decisions and update the risk management program. So we should constantly looking to meet new challenges, threats, and opportunities to our business. We are currently entering in a possible new regulation that has been stalled but looked like it's going to be enacted on December 1st, and that is the USP 800 handling of hazardous drugs. Last week, in 2019, the State Board of Pharmacy said at this point they would not enforce this. They would wait for the regulations from the FDA and the USP, but they would also evaluate pharmacies for hazardous drugs when they do inspections. So there's always new challenges of how we're going to handle these things. And an example is, how does a pharmacy decide to offer immunization? There are risks. Like I said, all pharmacists have to be trained in CPR and renewed that every 2 years. Pharmacists have to have an emergency drug box. They have to have a collaboration with a physician. Once these new risks are identified, the manager must create strategies to minimize those risks. Techniques to manage risks. One is risk avoidance. While avoiding risk may sound like a logical approach, it's often impractical for most risks in a business environment. For example, most pharmacies cannot and would not avoid dispensing prescriptions despite inherent risk. However, an example of this is in the opioid situation. A lot of pharmacies are now recommended to make sure that they're verifying that the physician has an appropriate indication. They're documenting that they're educating the patient about the risks. Patients who are on greater than 50 morphine milliequivalents, where they're at risk for possible respiratory depression, are now being counseled by pharmacies and encouraged to get a Narcan prescription, and pharmacies can dispense Narcan now through standing orders here in Pennsylvania. A second technique is risk modification and prevention. Pharmacy managers may not be able to eliminate risk, but they can take steps to minimize the likelihood of this occurrence. As I said in my earlier example, risk avoidance is obviously not filling anything, but risk modification is what I just described about having some type of policy of how we handle opioids. Our pharmacies at this time now do not fill any opioids within less than 3 days that they're due. And also, if the patient is on a benzodiazepine along with that opioid, we're calling the physician and documenting and educating the patient on the risk of respiratory depression. Another example is using the Institute for Safe Medicine Practices, the ISMP, and using their resources to evaluate your pharmacy and to help minimize medication error reduction. You should also have some type of documentation system when a med error does occur, and have at least quarterly meetings with your staff on how reviewing those med errors and how we're going to reduce the risk of those in the future. Risk absorption and retention. Pharmacies commonly accept losses owing to shrinkage, usually by losing profits or passing on higher prices to consumers. A deductible on an insurance policy is an absorption of a risk. So a lot of times pharmacies have contracts where they may lose money, and so they kind of absorb that. Pharmacies may lose product due to going out of date, so they have to factor in that type of loss. And the way to minimize those obviously is to evaluate our pharmacy contracts, evaluate whether also too is having type of good system to identify when drugs are going out of date, and seeing when we can ship them back to get some type of credit and minimizing that loss. Other options is risk sharing or transfer. Insurance companies commonly share or transfer the risks inherent to paying for health care for their beneficiaries by entering in capitated agreements with providers, paying them a set amount per member per month. Healthcare providers can also purchase insurance to share or transfer the risk for patients whose costs exceed the income provided by the capitated contract. So, obviously, a lot of times we are getting liability policies to cover what would the risk be if the patient had to recuperate any damages due to med errors. So is $1 million per occurrence enough, or is it $3 million? What is your umbrella to cover that? As I said, one may choose to absorb certain risk if the cost of insurance is very high and the potential loss is small. So we have to look at the risk versus benefit of where do we purchase insurance. Risk prevention is an important component of effective risk. Risk prevention is an important component of effective risk management and is generally used in tandem with risk transfer. Risk prevention includes the use of smoke alarms, security systems, theft detection, Additional employee training programs, yearly training programs on HIPAA, on fraud, waste, and abuse, on training if we have immunization on OSHA standards to protect employees from needle sticks. And as I said before, we are now entering in USP 800, which protecting employees from hazardous drug use. And how do we handle this? And how do we store these drugs and dispense these drugs? This table comes from the pharmacy management book, and it looks at pharmacy risk in different causes of effect. So there's strategic risk. All right. So what is the financial risk of this? A budget constraint, low or no return on a product. And what can we do? Is we know we may have to reduce personnel. We need to get better skilled personnel to help prevent this. Performance risk, low or no return, patient injury. All right. And obviously this risk is related to that if we had numerous med errors, poor customer service, then we could lose customers, and this puts us at risk of decreasing our revenue. Operational risk is probably the risk we most commonly think about, and that is data theft, loss, and patient injury to med errors. And what is the overall consequences of this? Loss of customers and trading partners. There's also psychosocial risk, where we may see productivity loss and increased health benefits for our employees if they feel that they've been harmed due to situations happening in the pharmacy. So obviously pharmacies have to have numerous types of insurance. They need to have property insurance to protect themselves against patients, in terms of fire and loss. Liability insurance due to risk of harm to patients and customers, whether that's falls out in the pharmacy or outside of the building, or medication errors. There's insurance for business owner policies to help protect against potential losses. There is individual liability insurance. Besides having an umbrella to cover liability for med errors, you should encourage all your pharmacists or have some type of policy where they can purchase liability insurance. There's the umbrella for or excess liability, especially if a significant med error occurs. And there's obviously workers' compensation if any of your employees would get hurt in the job to cover for their losses and expenses. There's also technology risks. There's digital risk issues. And so we need to look at, are we protected if we would have some type of data breach? There's also performance risks. What happens if, say, that, we lose, several days due to power outages? So a lot of times productivity can be covered due to loss of business. There's also digital risk issues in operational risks. There's people stealing, data, external, internal fraud. And so human automation trade-offs such as med errors due to automation. So these are operational risks that should be covered. And then there's the psychosocial risks such as health hazards, repetitive motion injuries. So we need to have good workman's compensation to be able to cover our employees on these types of risks. When we look at insurance terminology, there is the following. Coverage. What is the scope of protection provided under the insurance contract? Up to how much will they cover in terms of a loss? Co-insurance is a provision that requires the insured party to share absorb some of that cost. For this may require you to pay 20% of replacement costs. A deductible is usually the amount or fixed of an injury loss to be paid initially by the policyholder. And once again, this is something you determine. Obviously, premiums can go down if we have higher deductibles, but you have to think about what that is. Disability insurance is a type of health insurance that provides monthly income to the policyholder if he or she becomes unable to work. I encourage all community pharmacy owners and community pharmacy managers and pharmacists in general to have some type of short-term disability or long-term disability, especially if your employer does not offer any. Insured is the party covered by the insurance contract or the persons entitled to the benefits under the terms of policies. This could be example of family members covered under the employee's health insurance plan. And liabilities is the individual's responsibility for causing injury to another. And so this usually sometimes requires, a ruling either by the insurance company or by a court of law. Peril is an insurance terminology for risk, possible cause of injury or event causing damage or loss. Policy is obviously the written contract for insurance between the insurance company and the insurance party. A rider is term used to describe a document that amends or changes the original policy. And an umbrella liability is a form of insurance protection in excess of the amount covered by other liability insurance policy. It also protects the insured situations not covered by usual liability policies. For example, workman's compensation, medication errors. And the policy pays benefits to employee for job-related injury or death. So let's take a look at an example that comes out of our pharmacy management book. We have Bill Halsey, PharmD. He has spent the past 2 years since graduating from pharmacy school working as a staff pharmacist for a well-respected community pharmacy to refine his skills as a clinically oriented community pharmacist. Bill's dream is to someday to return to his hometown and purchase the pharmacy that inspired him to pursue this career. That day seemed to arise even sooner than Bill expected when he learned that Mr. Simmons, the longtime owner of Corner Drug in his hometown, has suffered a minor heart attack. Mr. Simmons would like to sell the Corner Drugstore and move to a retirement village. Bill quickly scheduled a trip back to home to visit with Mr. Simmons and inspect the pharmacy to see what it might be worth. He also evaluated the current state of the pharmacy, providing specialized services in diabetes and geriatrics. Bill was somewhat surprised to see the pharmacy was essentially in the same condition it was when he worked there during high school. Mr. Simmons had always enjoyed chatting with customers, so the pharmacy counter was very small with wide openings on both sides, so that he and his employees could easily move in and out of the pharmacy department to interact with customers. The desk where the clerk took care of the insurance claims, paperwork, and charge accounts was in the corner of the customer waiting area. The computer appeared to be somewhat ancient, and Mr. Simmons joked that the high school students he hired as clerks often had to help him with the computer would start acting up. Bill was understandably concerned. The delivery cart could best be described as a beater. He had been serving as the Health Insurance Portability Accountability Act compliance officer for his current pharmacy and was wondering what, if any, security and privacy measures were placed at the Corner Drugstore. Bill also remembered Mr. Simmons lecturing him on his philosophy of unnecessary reliance on insurance and wondered how well the pharmacy was protected from harm or loss or liability. Mr. Simmons always told him, your customers will never sue you if they love and respect you, so treat them well. Bill was beginning to question himself to see what may lie in store if he bought the Corner Drug, as he now contemplated several emerging unresolved issues that could threaten the ability of the pharmacy to exist and prosper. So obviously this example is an example of how a lot of times pharmacies may be underinsured. And obviously when we are talking about operating costs and the financials of a pharmacy, obviously overinsurance, paying too much of a premium, can cut into our net profit. But obviously, what is the risk if we have one lawsuit? What is the risk if we have one security breach? And although this is not the most exciting lecture out of all of our management lectures, it is one that a pharmacy does have to take into consideration. And I encourage you on the following: making sure that how does your pharmacy handle their HIPAA protected information? How do they handle med errors? What's the way that you have verification systems to prevent med errors? Using the ISMP evaluation reports to identify that. Also look at what are the risks that are associated if we included new pharmacy enhanced services. So please take a look at the readings for the risk management, and please ask me if you have any questions based on it. And if you have any insurance questions, this is something that it's not in my department in the pharmacies I operate that I deal with. However, I am very cognitive on how we document in terms of med errors, how we handle our workflow to prevent med errors, how we handle HIPAA protected information, especially as we get into MTM's immunization. So please feel free and ask me any of those questions and what policies that we put into place to protect ourselves and minimize our liability. Thank you.